I am Dr. Scholastica Nakol. I'm a medical officer in the Department of Internal Medicine. The first time I heard the word COVID, panic first struck me. And then I just sat myself down and asked myself, so if everyone is scared of COVID, who is going to manage the COVID patient? And that is when I felt the motivation growing within myself. So I felt this was an opportunity to learn how to manage a pandemic. For those who have managed diseases like Ebola before, they have had an experience. But for me, I decided to look at this as a chance to learn how to manage. But also what motivated me is, it's difficult to go through Lacho and not get motivated. Every time I walk through this hospital and think about people who have walked in this hospital before me, especially Dr. Lukuya, I can't help but get a drive to be part of the change, part of the solution. So as an individual, I've attended a number of trainings with regard to management and handling of suspects and confirmed cases of COVID. But also, most of us know that preparedness goes beyond the medical skill or the medical knowledge. So psychologically, I can also say that I am prepared for it because the hospital as a whole has been supportive. So we have had different teams, different people involved in the preparation of the team, particularly the case management team. I feel proud to say that Lacho as an institution has invested a lot of time and resources to see that the staff members have all the information and all the necessary training required. The team under which I fall, which is one that handles spiritual and psychosocial support, is a subcommittee from the Lacho COVID task force. So as the spiritual and psychosocial team, we have so many things lined up to try and make sure that our staff members get as much support, at least in terms of psychological and mental health issues, as possible. And some of these, the activities that we have in store for them, we are going to be involving them in the management or reduction of stress. So we'll involve things like relaxation techniques. We are also going to encourage people to be more physically active in terms of doing exercises. We are going to advocate for people to embrace new activities, new games, meditation, yoga. We are trying to avail as much variety so that everyone is incorporated. But also we are trying to liaise with other professionals, particularly the psychiatrists, the counselors, just to make sure that everyone is covered. Because for us, it's not just COVID. We want the welfare of the staff to be all round. So whether it is a family issue, whether it is any other social issue, if there is something that we can do about it, we are willing to support them all the way. Yeah.